Let's talk about the selective NSAIDs. These are the ones that you're going to see in practice more commonly, except for phenylbutazone and flunixin meglumine in horses and surpass. But in small animals, these are the ones that you will commonly see prescribed because they have better avoidance of those gastrointestinal results in particular. So, carprofen or Rimadyl, there are other brands of this drug because it is now generic. Totolac, we don't see it as much. Daracoxib, meloxicam, firacoxib, and robenacoxib. So these are all kind of more newer drugs and have better outcomes as far as avoiding some of the side effects of this class of drugs. So, carprofen, otherwise known as Rimadyl, and some other names these days. It is selective again, remember, for COX-2 versus COX-1. COX-1 has the protective GI mechanism, so we don't want to inhibit that enzyme. COX-2 is the inflammatory one, but at higher doses, I want to just caution you, at higher doses, that effect is not as lasting. So it will affect COX-2 and COX-1 enzymes. So, but in general, if it's used at the regular on the label doses and more toward the lower end, we're going to see less gastric ulcer potential. And we do have it available in a sub-Q injection, but more commonly we're going to send it home, especially for animals. Post-surgically, we'll send home some oral medications, and if we're treating for arthritis on a long-term basis, it's going to go home as an oral drug. One of the things about it is a flavored tablet, and owners need to be cautioned, especially kind of those big dogs like golden retrievers or Labrador retrievers that might have a potential for getting a hold of this bottle. They want to store it away from where the animal can get it, because once they recognize that bottle associated with those nice chewables, they might be tempted, if it's just left on a countertop and a dog can get to it, they might grab it, and we can run into some toxicity problems if they eat a whole bottle. It is dosed once a day or twice a day. Originally, it came out with a BID administration, and then a competitor that I'm going to talk about next had a once a day dosing, so they went to that as well. We use it for arthritis and post-operative pain. That is the most common thing that it's used for. Etodolac, it was known as Etogesic. Etogesic actually got taken off of the market, but there are generics of Etodolac that are out there still. And this one was touted as being less ulcerogenic. Bear in mind that the studies, there are scientific studies behind, how effective these are in just targeting COX-1 and COX-2. We really don't have a lot of evidence that one product is superior necessarily to another. The main thing that you want to look for as far as targeting studies that show that it absolutely targets COX-1 or COX-2 or vice versa. So bear in mind that we want to look at the actual results as far as causing gastrointestinal problems. That's usually the thing that we're going to see first. So this product was only used in dogs. It was used for arthritis. The big thing that has taken it off the market, and the reason why many veterinarians will not even stock it in their clinics, is this potential to cause keratoconjunctivitis sicca. This is known as dry eye. So what it does is it can inhibit the production of tears when an animal develops this, and it's not reversible when we, from this drug. What happens is the animal then has to be on a drug regimen for the rest of its life to treat the dry eyes, and that involves giving an ophthalmic medication several times a day. So because of that, and because we have Rimadyl and a couple of other drugs as choices, this drug is not used as much Just wanted to make you aware of it, however, because there are generic forms out there and some veterinarians may still stock this drug. Meloxicam is a newer one, and this one has unfortunately been shown over time. So once these drugs get released on the market, this is when we truly see, once it's released to the general population, what problems can occur on a greater numbers basis, right? We're just using clinical trials to look at smaller numbers, but then once we get it into the population, we start to see things like that hepatotoxicity that was shown in dogs. And your book goes into how in when Rimadyl was released, how there were some initial cases that made owners fearful to treat their animals. And it once we got the numbers out there, it's very few numbers that hepatotoxicity shows up in with Rimadyl administration. But initially, it was making people wonder about it. And it seemed to show up in Labrador retrievers. And so it was avoided in or given very cautiously to Labrador retrievers. And once we had more numbers, we realized it wasn't just Labrador retrievers. It was probably just that we had larger numbers of Labrador retriever owners wanting to treat their dogs for arthritis. And so they were some of the first ones to be treating their animals for it. So hepatotoxicity is a small, typically shows up small numbers in animals treated with these selective NSAIDs, but it is out there. Meloxicam, we have seen more gastrointestinal upset in using this drug than with Rimadyl. So the advantage of it, however, is we can treat cats with this. The typical regimen is just one treatment, and we want to be very careful with that and carefully watch cats if they're treated with Medicam or Meloxicam. But a big advantage is this liquid dosing. So we can get it titrated more closely to the calculated dose. If I've given you some problems where we're looking at treating animals and we calculate a dose and then we have to select from what we have on the shelf. And we may get very close to what we calculate, or we might need to make a compromise. In the case of Medicam, we can get it very close. So hopefully that will avoid some of the GI tract upset. We can make it smaller rather than a larger dosage, and that way get closer to a therapeutic level with hopefully without the side effects. So that also makes it easier in treating cats, right? Because cats, we are on the low end of usually what is out there as far as a pill or a capsule. So if it's in a liquid, we can get it very close to an appropriate administration for a cat. It's once a day dosing, and we just want to make sure that we're always looking out for that gastritis potential and letting owners know what the signs of that are, and for any of these NSAIDs, and letting them know that if they see any vomiting, diarrhea, or black tarry stools, they need to contact us immediately. Daracoxib is another drug that is a COX-2 inhibitor. It's only approved for use in dogs. We use it for post-op pain and osteoarthritis, just like Rimadyl and Medicam, and it's a once-a-day chewable. Robenacoxib is an interesting drug. This is being used in Europe, and it is only approved for cats in this country currently, but potentially it might be approved for dogs in the future. It does have a potential for hepatotoxicity. So owners are warned if they see an animal not eating or icterus. Icterus is yellowing of the whites of the eye or the mucous membrane tissues where we might be able to see it. So pale white in other words, normally white furred animals, and where we'll see the mucous membranes as being a light color instead of pigmented, that yellowing jaundice can show up, or icterus is our $10 word that you are paying to learn as a vet tech student. In cats, we can only use it for 3 days. It comes in these little blister packs. I'm trying to point to it. So there's only 3 tablets. You hand out this card to the owner. They give it sequentially for 3 days. Interestingly enough, if they're in Europe, they can use it for 6 days. So it's been used for post-op pain after castration or spay, and it's kind of a nice drug that we're able to give to cat owners these days. Firocoxib, or Previcox equox, is used in small animals, in dogs, and in horses. It might be used for cats in the future, kind of keep it on the radar that you might see this one able to be used for cats. Similarly, used for this musculoskeletal pain and surgeries after orthopedic surgeries. So it's useful in horses, dogs, and maybe we'll see it in cats in the future. Want to emphasize that even though these are COX-2 selective, that we still want to be sure that owners know what the side effects are, what to watch for. So we don't want to get, even though you'll be handing out these drugs to owners very often, don't get complacent with these drugs. There's always the possibility that this will be the animal that will react in an adverse way. So when you're doing callbacks, so vet techs will call back owners a day or two after a surgery or after giving a drug for the first time, you want to make sure that you carefully question the owner whether they're seeing any of these potential side effects.